today. Hello, I'm not sure you heard the beginning of my speech. I'm just going to start again. Welcome to the second part of our wellness series, Yoga and Meditation for Brain Injury, offered by the National Association of State Head Injury Administrators. I'm Maria Crowley, NASHIA's Professional Development Director, and Haley Cushion is behind the scenes organizing our webinar today. She's our Member Services and Communications Coordinator. Thank you so much for joining us. If you're unfamiliar with NASHIA, we're a nonprofit organization created to assist state government in promoting partnerships and building systems to meet the needs of individuals with brain injuries and their families. A go-to user guide is available for download from the NASHIA website. It's a great resource for making the most of your live webinar experiences. Handouts of today's presentation are available for download. They'll be located in your attendee control panel in the handouts pane. In order to ask a question during the webinar, please enter it in the questions pane on your control panel, and our organizer will forward your question to our speaker after the presentation. If we run out of time, the presenter will respond to your questions via email. Continuing education credits for social work and certified rehabilitation counseling, as well as general certificates of attendance, are available for today's event. At the end of the webinar, you'll receive an email and an evaluation with instructions on obtaining credits. The webinar will also be archived for later access on our website. Today's slides are also in the document pane for you to upload, as well as a fact sheet from Love Your Brain. I would now love to introduce you to our presenter. Dr. Kyla Pierce is Senior Director of Programs at the Love Your Brain Foundation. She oversees much of the integrative health programming across the U.S. and Canada. She's a member of the Pierce family, and some of you may recall Kevin Pierce and the accident that he had, which played an integral role in the launch of the foundation. Kyla blended her expertise as a yoga instructor and researcher to develop the Love Your Brain Yoga TBI-centered yoga curriculum, which she trains yoga teachers and clinicians to deliver in facilities across the country, including the program we have here in Alabama, which is great. She teaches the program near her home in Vermont and co-facilitates Love Your Brain retreats across the country. She's also a postdoc research fellow at Dartmouth, investigating the impact of yoga for people with neurological conditions. Welcome. We're so glad you're here with us, Dr. Pierce.
Thank you so much, Maria, for the warm welcome, and to all of NASHIA for hosting me. This is certainly a topic I'm very passionate about, and it's wonderful to be able to share it with this group. So I will just go ahead and start sharing my screen. Bear with me a moment as let's work on the tech. All right.
No worries at all.
So again, thank you for choosing to be present with me today. I know there's many other places that it looks like we have just about 100 people joining us from, I'm sure, across the country, maybe outside. So what I hope to do in our time together is first open with a little experiential activity to embody yoga and meditation before we start diving into some of the more technical aspects. So I'll then move from an experiential activity to describing some of the evidence-based benefits of yoga and meditation specifically for brain injury. Talk through some of the best practices for how to adapt yoga and meditation for brain injury, and then have a conversation around how different key stakeholders like clinicians, advocates, people in government administration can implement yoga for brain injury. So what I hope by the end of this presentation is you'll have not only an embodied sense of this transition, but a bit more clarity around some of the science and theory behind how to make yoga truly accessible and safe for the brain injury population. So before we start diving in, let's just use the next few moments to land in our bodies. So what I'd like to invite you to do is take a few moments to adjust your seat. So depending on if you're sitting, lying down, you can even stand. Find a way to position yourself so that your spine is tall. Your feet are gently but firmly grounded on the floor. Your hands, if you're sitting, can rest on your thighs or down by your side. But take a few moments to shift perhaps your weight side to side to start to arrive in your body. If it feels okay for you, you can gently close your eyes, or you can find a soft gaze at the floor. But let's begin to notice this as a transition point in your day. For a moment, reflecting on all the things that have already passed and all the things that are yet to come, and beginning to arrive in this moment in your body. So let's begin to open our senses just to notice the space that you're in. Opening your ears to notice sounds that may be in the distance. Any sounds closer by, perhaps in the room you're in. Without searching, just simply allow the sounds to come to you. As you welcome your external environment into your awareness with a sense of curiosity and openness. Begin to guide your awareness now inside yourself to notice the shape of your body, the position that it's in. Notice the temperature of air along your skin, perhaps the sensations of your clothing caressing your arms and legs. Feel a softening move down through your jaw, perhaps gently gliding it side to side. Notice any tastes emanating from your mouth. Feel a softening down through your arms as your shoulders, elbows, and hands drift downward. Notice the connection of your seat or your feet to the surfaces supporting you. The steadiness of this support, how it does not change. And now begin to notice the pace of your breath as it flows in and out, creating space and a lift on your inhales, and a settling and a release on your exhales. Without changing it, simply become curious about its pace, how it subtly pulses your body. Can you relax a little more deeply into your exhales? Softening into its descent. Let's all take a deep breath together. Slowly breathe in, feel your chest expand. And open your mouth and sigh out. Let's do that one more time together. Slow breath in. Slow sigh out. Gently notice the aliveness of your whole body with no expectations. So welcoming of where you're starting from today. Take your hands and cross them over your elbows, and then begin to gently massage the sides of your arms, maybe moving up towards your shoulders. With any gentle, nourishing touch along your arms, maybe moving up towards your neck. Finding just the right amount of pressure and touch to create a sense of connection to your body. Eventually arriving in stillness, hands crossed over your heart, absorbing this moment of acknowledgement, of embrace, of feeling yourself showing up just as you are. Let's all take a breath together. Big breath in, feel your heart lift up into your arms. And slow breath out. And if your eyes are closed, you can begin to gently flutter them open. Release your arms in your own time. And just notice with your eyes open how your body feels, how your mind feels. All right. Well, thanks for at least giving me the space to have a little bit of embodied practice before we start talking through some of the concepts. It feels really nice to connect with you all. I know we're all spread out all over the US, but to have that shared moment. So thank you. So now I'd like to unpack a little bit of what I just did. Many of you, I'm sure, have either practiced, read about, or heard of yoga. And there's often the misperception that yoga requires you to be able to put your body in very complicated positions and that it's only a practice that involves the body. But just so we're on the same page about what yoga is, I'd like to introduce the 8 limbs of yoga. So yoga does involve physical movement, which in Sanskrit is called asana. So we did a little bit of physical movement with a mindful attention in that last practice. It also involves breathing exercises called pranayama. Also includes meditation, a set of moral principles, and using this framework, the intention is to create a sense of integrated, complete well-being. So yoga has many different facets. What is exciting that as there has been a proliferation of yoga throughout the United States, there is an alignment between the best practice for allopathic medicine, the biopsychosocial spiritual model, especially in rehabilitation medicine for brain injury, with the Panchakosha model, which describes different energy levels, awareness levels, specifically 5, that a yoga practice is designed to activate, or at least bring awareness to. So for the clinicians in this space, the exciting thing is as you're working through the biopsychosocial spiritual model of rehabilitation, that very much maps onto what the intentions are behind yoga. So ultimately, what is powerful about yoga is that it is meant to integrate mind and body. So it's a holistic practice that doesn't just work at the level of the mind, doesn't just work at the level of the body. It integrates the two. And this is one of the reasons why it has so much potential for healing benefits for individuals affected by brain injury, since there is often the disconnection between mind and body. And given that we know brain injury is so heterogeneous and complex, it is a holistic healing modality that can meet the individual where they are, be it working on balance, be it working on cognition, be it working on social interaction. So it has a very dynamic quality. Now that we've talked a bit about what yoga is, potential benefits, what is the evidence that suggests specifically there are benefits for the brain injury population? So in the US, there is a growing demand for yoga, as well as evidence suggesting its potential benefits. In 2007, I believe the NIH commissioned a survey of adults in the US that asked for self-reported practice of complementary and alternative medicine. What they found is in the survey, which about 24,000 adults who were nationally representative participated in, that the three growing therapies included deep breathing, yoga, and meditation. And specifically in terms of the potential benefits, systematic reviews and meta-analyses have found that yoga improves anxiety, depression, sleep, stress, and chronic pain. Also has benefits physically, including strength, balance, and mobility. And also cognitive benefits, including attention, memory, information processing, and executive functioning. This is in the general population. A further study compared individuals with and without common neurological conditions, including brain injury, and found that individuals with common neurological injuries reported a higher use of complementary and alternative medicine practices, including yoga, than people without, which was correlated to people saying that either their medical treatment, more traditional medical treatments were too expensive or ineffective. So there is a growing demand and evidence. There's also more and more interest in the scientific sphere around measuring the direct benefits of yoga. And in this case, this was looking specifically at mindfulness-based interventions. So this chart shows the dark line and the dotted line both show a very steep increase in the publication of both scientific articles and news media pieces specifically about mindfulness meditation. So knowing that mindfulness as one type of meditation specifically, or meditation is one form of practicing mindfulness that is incorporated in the yoga that we use specifically for the brain injury community, I'd like to play a video that describes what mindfulness is. So John Kabat-Zinn is the originator of the mindfulness-based stress reduction program, a medical doctor based in Massachusetts, and he uses the operational definition of mindfulness as paying attention in a particular way on purpose, in the present moment, and non-judgmentally. So how does this have application for brain injury?
After a brain injury, it's easy to get swept away by what we wish was different. We often get stuck in the past or future, causing anxiety and stress. So what can you do? Mindfulness is a tool that empowers you to approach life with more balance and perspective. Imagine it this way. Your mind is like the ocean. Your emotions and thoughts are like the waves. Sometimes they're moving like a calm ripple, other times crashing down one after another. There's no way to stop the waves, but you can learn to surf them. Mindfulness is not about stopping thoughts or feelings. It's about changing your relationship to them, viewing them with a little more perspective. And when you do, even in the rockiest seas, you find a place of calm within yourself. The good news is, mindfulness is an ability every human has. You just have to practice. Practice with us through meditation, yoga, or simply pausing to notice your breath. How does mindfulness show up in your life? The power is within you.
So mindfulness is a evidence-based practice that is increasingly being offered to the brain injury population. And in terms of some of the neuroscience, what we're learning more and more is that mindfulness leverages different and activates different parts of the brain associated with executive functioning, or the task positive network. So this image describes how on the left, the default mode network describes the state of activation in your brain when you are at rest. So meaning when you are thinking about the past or reflecting on the future, where there's processing about the self. This is associated with mind wandering and discursive thinking. Whereas when you use mindfulness and bring focused attention to something specific, such as what we did in our opening practice on the breath, on sound, on the body, that activates different structures in the brain that help regulate attention and focus attention on the present. And with brain injury, there's tremendous application here, knowing that attention regulation can be compromised, discursive thinking and management of negative thoughts can also be challenging. So using mindfulness to bring awareness to your present experience, but really importantly with an attitude of openness, of kindness, and ultimately of acceptance, not in a sense of necessarily agreeing with your experience, but honoring that the experience that you're having is what is happening, and then creating some space to choose to respond in the most strategic or best way to serve your needs. So learning how to pay attention in that particular way has been both scientifically shown to improve different outcomes in the brain injury community, which I'll talk about in a moment, and is now more and more widely accessible. So what I'll go through now is knowing that there has been this tremendous growth in research and interest and demand in yoga, including meditation and including mindfulness. I'll talk a little bit about some of the research studies specifically for the brain injury population. So there are a growing but still small number of studies specifically investigating the impact of yoga and meditation for brain injury. Most of these studies are involving mindfulness-based stress reduction interventions. So these are 8-week programs that typically include about 30 hours of contact time, 40 hours of homework time, so they're quite comprehensive. One study by Cole and colleagues found in 9 veterans with co-occurring post-traumatic stress disorder and mild traumatic brain injury, after participating in an 8-week mindfulness-based stress reduction program, these individuals reported improvements in attention skills that were significant. They also assessed whether the effect was sustained after 3 months and found that, again, the improvements in attention skills were significantly sustained 3 months after. Another study of a mindfulness-based stress reduction program, this time with 22 individuals with mild traumatic brain injury and post-concussion syndrome, found improvements in working memory in a pre and post assessment. One of the only randomized controlled trials conducted by Johnson and colleagues, this included 18 individuals with stroke, 11 individuals with traumatic brain injury, who again participated in an MBSR program, and found improvements in information processing, which led to reductions in cognitive fatigue. So those were significant over the control group. And then the 2 other studies I'll mention, one was a 9-month chair yoga program for individuals with severe traumatic brain injury, found improvements in different psychological outcomes related to stress. And then finally, Arlene Schmidt and colleagues did a 8-week intervention that was one-on-one with 3 individuals with traumatic brain injury and found a variety of different physical benefits related to strength, mobility, and endurance. So the takeaway here is there are diverse potential benefits of yoga. However, the research is limited by small sample sizes, different protocols, so it has made identifying best practices for the delivery of accessible yoga for brain injury just more complicated. So I'll talk about how I've been trying to address that through the organization I work for. So the innovation that I'll talk about is how then, knowing there's a growing demand, there's potential benefits, how can we work to address the need for this potential multimodal healing intervention that has great application for ongoing benefits at different stages in the healing journey post brain injury. So both during acute, during post-acute, and during the community integration stages. I'll play a video to introduce the organization Love Your Brain that I work for, just to give some context.
Nearly 6 years ago, former snowboarder Kevin Pierce was at the top of his sport until a near fatal crash and traumatic brain injury changed his life forever. Now, through his foundation called Love Your Brain, Kevin has become a national spokesman for recovering brain injury survivors. Sharing his story along the way, he seeks to convey one simple message.
There's nothing more important than your brain, and you need to love it like you love anything else in life. For me, it's going out there and talking to these millions of people that have injured their brains, that do have the ability to heal, and providing that help and support has been very impactful and very cool for me to be able to do something that feels like it's so needed right now in such a huge way.
Love Your Brain is not only the message that Kevin and we all live by, but turned into this foundation, the Love Your Brain Foundation. And what we're really all about is creating community to improve the lives of people with brain injury.
The Foundation's latest initiative is to help that community through the spiritual exercise of yoga, teaching and incorporating techniques aimed specifically at brain injury survivors, beginning in Kevin's home state of Vermont.
The number one thing I feel like that has healed my brain the most is yoga. It was just like the most amazing thing for me to be able to just like calm my brain and calm my mind and just like slow down, yet I was moving.
I'm a physical therapist. I used to work in a rehab hospital where I was working with brain injuries and spinal cord injuries. I'm hoping to gain better knowledge how to support my patients that I see and to better understand their mind-body connection.
Brain injured people need this desperately, and his charisma, his ability to get this out will be huge. It's the perfect way to get someone who has difficulty with social issues involved, because yoga people are wonderful people and they're accepting, and it just feels good.
With a traumatic brain injury, there's so much physical rehab that you go through that sometimes the spiritual side of thing and the mental side of thing gets left to the wayside. And that's a big proponent of how somebody recovers from something, is how they can feel confident in themselves and see a future.
He will never be a world-class snowboarder again, but ironically, Kevin's crash has given him clarity in the years since, allowing him to carve a new path to enlightenment for himself and for others around the world.
It's really hard to come to grips with understanding of how different my life will now be because of that fall, but that I have taken the path of where I do still have hope through the foundation, to give the hope and to not allow people to give up and never to settle for less.
Pain is inevitable, but suffering is a choice. And I think when you realize that, we're all going to go through painful situations, but I think if we can build resilience and resources around us to help us get through these difficult challenges, that anything is possible.
Everything happened for a reason, and there was a very good reason that happened that day. And not for one moment do I feel like I would want to be in a different place than I am right now, because I feel like what I'm doing and who and how I'm helping and what I'm learning and the things and the path that I'm taking now is so perfect.
So the main program that stemmed from Kevin Pierce and his brother Adam Pierce founding the Love Your Brain Foundation in order to build community and promote resilience among the traumatic brain injury population is Love Your Brain Yoga. So this program has operated for 5 years and is designed for people with traumatic brain injury and their caregivers to build community and facilitate building skills and resilience, which I'll talk a bit more about in a moment. The structure of it is a 6-week program. Each class is an hour and a half that has a specific structure. There's 10 minutes of breathing exercises, 40 minutes of the movement component of yoga, 15 minutes of guided meditation, and 20 minutes of facilitated discussion with psychoeducation to create community connection. So these are group-based programs that we offer across the US and Canada. And we'll talk a bit more about the research, but there are specific objectives for each of those components. This is the group discussion, a picture of one of our group discussions. And this is really one of the unique features of the program. So if you are looking to design a yoga program or offer a yoga class for the brain injury community, knowing that community integration has so many barriers for people affected by brain injury, this group discussion component has been one of the most valued and impactful elements where people really can normalize and validate each other's experience, build relationships that last after the program. So we focus on resilience, which is defined as one's ability to adapt positively to adversity for a couple reasons. First, there's research that shows building skills and resilience can improve different outcomes, different functional outcomes following brain injury. It can improve adjustment and coping to one's new reality and enhance motivation and also improve symptom management. This book, written by Stephen Southwick and Dennis Charney, identifies 10 different factors that individuals who are resilient employ. And what's important to highlight here is that often, and especially now in the time of COVID, there has been a plethora of resources honing in on the relevance and importance of resilience. And resilience is not just one thing. So these researchers conducted interviews with people who had experienced complex trauma. And in these interviews, 10 factors were revealed that allowed these individuals to demonstrate exceptional resilience. One was having a realistic optimism. So seeing that a kind of a glass half full, glass half empty attitude, that yes, there will be challenges and roadblocks, but how can we find workarounds to still find a way forward? Facing fears, using fears as a way to enhance learning and growth, having a community for social support, a religious or spiritual practice, role models in your life that you can emulate their qualities and use to inspire you, physical and brain fitness, cognitive and emotional flexibility, and finally, finding meaning and purpose in the adversity to help create a new sense of identity, worldview, to still feel a sense of positivity. So what's exciting about this is yoga can encompass all of these. So our program is designed so that each class is based on one of those resilient factors. We also, as I talked about before, knowing that the research does show potential benefits, but is relatively small in number, we are also actively conducting our own research and collaborating with others to provide an evidence base behind Love Your Brain Yoga and more broadly accessible yoga for traumatic brain injury rehabilitation. I'll talk through these pretty briefly, but here are just 4 examples of studies. One was a pilot study that informed the design of our curriculum. One was a qualitative evaluation. This most recent article is actually the largest study of yoga for traumatic brain injury that's been published, which included just over 1,500 individuals with brain injury and caregivers. And then finally, we recently published a study that identified best practices for adapting and delivering community-based yoga for people with traumatic brain injury in the US and Canada. So I'm offering this as a resource for those of you on this call who may be yoga teachers or interested in integrating yoga-based tools into your practice, clinical practice, or elsewhere. this distills down some of the best practices that I'll also talk more about in this presentation. Quickly, the large study that I mentioned found improvement in 4 out of the 5 clinical outcomes that we assessed. We had complete data from 705 individuals with traumatic brain injury, and their self-reported scores showed significant improvement in quality of life, in resilience, in cognition, and in positive affect. There were no significant improvements in emotional and behavioral dysregulation. However, content analysis of the qualitative data did find that participants shared that they felt an improved ability to regulate intense emotions like anger, anxiety, stress, and impulses. And caregivers also perceived improvements in physical and psychological health outcomes. So for those of you that work in communities that there may be some resistance to yoga or still some misperceptions about it, using some of the research to help justify the investment or at least exploration of this practice can be helpful. And this is a study you could potentially reference or at least read. But to bring a little bit more of the human side, I thought I'd share a few quotes in our qualitative evaluation that highlight some of the elements that sometimes can be a little bit more difficult to measure. So first of all, there's a question, knowing the complexity of TBI and other types of brain injury, would people even participate in a yoga program in a community setting? So one individual wrote, so we had kind of a section where, you know, people greeted each other. We had a meditation section, a physical section, and a section where we got together and had a topic to talk about in a circle. So it wasn't just all one thing. She broke it down into sections, and people with traumatic brain injuries, we can't sit so long and we can't do things for long periods of time. So she had it broken down into sections, which was easier to do. So showing yoga, because of its dynamic holistic nature, can support potentially longer duration classes because of the different components that are comprised in a yoga class. In terms of perceptions of enhanced self-efficacy and resilience, one person wrote, definitely remember bringing awareness throughout my body. I think I'm not sure if it was the class in particular or if it was a different one, but I remembered feeling the sense of just being proud of what my body can accomplish rather than being frustrated about what I could no longer do. So a big element in yoga is to reposition the individual as the agent of change, determining the boundaries that they want to work on, really bringing the awareness inside to support someone to build the agency, to, again, connect with their body, feel a sense of accomplishment instead of perception of all the things that they need to address or change or manage. So it can have a very empowering feeling around, yes, these are the things that I may want to change, but these are also the things that I'm doing well. For self-regulation, one individual wrote, I think that's been the biggest thing is, this is a caregiver, the participant being able to stop and calm down and work through the anxiety phase. So the participant is able to kind of like, instead of getting anxious and say, oh my gosh, I've lost something and now I'm really stressed, I can't think straight, can take a step back and able to have a little bit of mental space. So we know with impulsivity, with dysregulation, using tools that help activate the parasympathetic nervous system are really powerful tools that are also in the inside, so are always a resource that people can carry with them to create a sense of groundedness and calm. So some of the ways to adapt yoga, since there are many different styles, to ensure that it's safe and can meet the variety of needs within the very heterogeneous experience of brain injury, are a few that I'll mention here. So poses need to be adapted to prevent dizziness and headaches, other symptoms like spasticity and neck pain. So careful attention to the position and movement of the head. In terms of supporting learning and memory, knowing cognitive fatigue, memory, information processing can be impacted The delivery of the class is also really important, using language and pacing that's simple, slow, and repeated, as well as movements that are simple, slow, and repeated. Demonstration and the use of props are really important, knowing that balance can be compromised, dysregulation of blood pressure. So we use a lot of props in our program and in our trainings. Excuse me. Knowing that different sensitivity to sensory stimuli can be a common symptom. Being mindful of the lighting, the music, the scents in a community space is very important. Strategies to focus attention, activate the parasympathetic nervous system, and manage negative thoughts, using those in the opening breathing as well as the closing meditation. And then finally, bringing a sense of community building through group discussion and empowering themes is also an important way to break down some of the isolation that can happen with brain injury and create a sense of self-efficacy and empowerment. So how can key stakeholders like clinicians, advocates, administrators be involved in the delivery of brain injury-friendly yoga? So I can speak a bit as an example with our program, and would certainly at the end welcome any other feedback and questions from those of you on this call. But ultimately, the vision for our program is to end with community integration. So to offer our program through a community-based channel in partnership with yoga studios, but then introduce it even earlier by partnering with different clinical facilities to integrate yoga-based tools for people who are seeking medical treatment for brain injury, so that once they're discharged and returning to their community, they immediately can segue into a yoga program in their community and use that as a portal to engage more broadly in their community. So yoga, because it's so dynamic, can be integrated in a more adaptive form in clinical settings, and then also in community settings once people have a different level of functioning, and then support greater community participation. So yoga studios have a role, clinical facilities have a role, and I'll talk more about the different other stakeholder engagement opportunities. Our program right now is in 35 US states and 4 Canadian provinces. COVID is certainly affecting the rate of expansion, which I'll talk a little bit more about, but we do still have a goal to provide geographic equity of access by 2023, and are more and more working with clinical facilities that have clinicians or even local yoga teachers that are invested in offering these tools earlier on in one's healing journey, particularly for caregivers as well, whose needs are certainly of equal importance in the brain injury journey, are starting to offer yoga-based tools earlier on. The way in which our program has been able to grow at such a fast pace is through partnerships with different stakeholders. So we have about, this past year, had about 2,500 people go through our program across the US and Canada. We found that about 50% of people who are participating, so people with TBI and caregivers are participating from referral from a clinician. So working with allied health professionals, neurorehabilitation facilities, for us to give in-service presentations about the potential benefits of yoga, do some experiential activities to help prevent caregiver burnout, clinician caregiver burnout. We also offer partial scholarships to attend our training in yoga-based tools for brain injury to different key program champions, like people with a lived experience of TBI, clinical stakeholders, and advocacy stakeholders. We do partnerships on research, as I mentioned before, as well as press, really trying to amplify the TBI voice and experience of using yoga to help break down some of the misperceptions, and supporting research collaborations to shift the scientific understanding of potential benefits of yoga. And if you're not in a state that currently has a Love Your Brain yoga program, helping us identify a potential studio or a neuro rehabilitation facility that we can train and support them to offer this free program. So I'll play a video that describes one of our wonderful students' experience using and really finding yoga for the first time as a supportive tool for her.
I had 4 major head injuries actually, and the first one was when I was about 11 or 12 years old. So I've not been sure about what's been going on with my body for a very long time, and it starts just gets more and more painful, and doctors and medicines, and I tried everything. So for you guys to start this kind of a program where it's not just yoga, which is helpful, it's modified. Looking at the website and entertaining the idea, could I do this, was so nice to see. The lighting could be adjusted, the music or no music, that it was adaptable. I hadn't had a lot of control over a lot of things in my life, and this idea of yoga seemed to be something that where I could gain a little bit of control. I signed up because I was in so much pain, and the depression sets in, and I was stuck on the couch being in pain every day, and I needed to try something. The pain might not get better, I might not be able to fix this, but I can learn other ways to not get so angry at it, or to be a better version of me, live with it and coexist. I sort of laugh at myself now because the idea of your breath, it's so easy and simple, and it really works. I can track the pain. I can go to an area and try and get my version of centered and breathe to that area, and I notice a difference. In learning to move my body and be in my body, I'm also wading through some darkness and emotions and wreckage that I've caused, and it's not an easy journey, but it sure is worth it. I can never figure out why I survived the accident. I had so much anger, and there's just all this damage headed, physically and otherwise. And the reason is to help the next person that's on the couch with a horrible headache, and there's no way out. And it feels that way. It feels so trapping. And you've tried every pill and every doctor and everything, and nobody has an answer for you. And you guys had an answer, and it was so simple. Just breathe. Be with us, sit in a room together, and do what you feel you're capable of. There's no way to do this journey alone. So if it has to be hummingbirds and dragonflies, and then it gets to be a dog, maybe a plant, you keep those alive, and then you work forward to repairing and making new human relationships. And that's the scariest part for me, I think, is I've lost a lot of people and a lot of myself, and I don't want to lose anymore. But this community offers me a safe place to try if I want, to be a part of something and to have people understand me for just being me. You meet people at wherever, a lunch or anything, and the first questions are always, what do you do and how are you? I hate those questions. I don't have good answers. But when you walk into a room full of people that know exactly the way you feel and you don't have to say a word, I have answers for those people. And I have hugs and I have time. And I thank you guys so much for giving so much time and of yourselves to give people like me stuck on the couch in pain with no other answer somewhere to show up and feel worthy and important and change things.
So what's next? And I think the realities that we're all, and especially the brain injury community, are facing with COVID are complex. And also we are really trying to see the opportunities in how to use the online platform, certainly knowing that there are accessibility issues that we as a collective need to address to ensure that online content can be well received by people impacted by brain injury. But there's also some tremendous benefits in terms of bringing the content to people directly in their homes without having to deal with transportation or scheduling. So what I'll talk quickly about is one of the new resources that we are making freely available for people interested in building skills and resilience through online yoga and mindfulness. This program is called the Love Your Brain Mindset Program. It's a free 6-week online program that has different tools that people receive by email weekly. They're educational videos. The video that I showed on mindfulness is an example of one of those videos. One of the weeks is dedicated to discussing and experiencing mindfulness. Meditation, recorded yoga class, and a recorded yoga nidra practice. I know last week, for those of you who tuned into the first part of the wellness series, there was a presentation on sleep. And yoga nidra is a practice that has been empirically shown to improve sleep quality. So and we know through at least our program anecdotally, that this specific style of meditation, guided meditation, can be very impactful for people affected by brain injury. And then also doing 45-minute group discussions to build community and connect individuals from the brain injury community. So we are making this available starting in October and have done a pilot launch and found overall really positive feedback and are integrating some small changes that we learned from this first phase, but feel really excited about it. And also just some resources for those of you who either want to explore them yourself or refer people in the brain injury community. There are different sources of free yoga videos. Love Your Brain has some on our website. We also have different meditations organized by length and style that are all freely accessible. There are a number of fantastic trainings and resources. For instance, Dr. Neff's self-compassion work. She's based out of Atlanta, Georgia, and is really one of the leaders in investigating and disseminating compassion-based interventions. So I encourage you to look at her work. There is a free online MBSR training that actually, this is not the free one, but there is a free one led by a certified MBSR trainer that if you're interested in doing a deeper dive in MBSR, that is something that you could access. And then Yoga International has a variety of different meditation and movement-based yoga classes, including chair classes that can be adaptive, and they have free offerings. And finally, just a big thank you to those of you who did tune in. I welcome questions and for you to follow up with any one-off questions that you don't have time to ask for on this presentation. My contact information is here. I'm based both with the Love Your Brain Foundation as well as at Dartmouth-Hitchcock Medical Center doing my postdoc there. So welcome research collaboration ideas or ideas around how to work together to ensure people have access to yoga from the brain injury community. And we have about 5 minutes left before the end of the hour, so I'd love to be able to offer some space for questions and comments. And I'll just leave the references up here as well. And I know.
There I am. Can you hear me?
Yes.
Great. We do have a few questions. Thank you so much. I want to just take the opportunity to say thank you. And I want to throw these questions out to you before you wrap up today. How would you recommend addressing parasympathetic nervous system? Is this just through deep breathing, or do you have other recommendations for specific moves?
Yes, so there's a lot. Breath work is certainly one of the best ways to work with balancing the nervous system. There are different poses, inversions. You need to modify the inversions, which we talk about in our training, and I'd be happy to talk about with this this person at a later date, but inversions can also activate the parasympathetic nervous system. So that's just when your heart is below your head, so a slight decline. And there can also be different sound techniques. So in yoga, Om is often chanted. You don't need to chant Om, but any sort of activation of the vagus nerve, which innervates your face and throat all the way down to your reproductive organs. So any vibration in the throat can also be a technique used in yoga to activate the PNS.
Great. Another question, have you approached the VA, since they're now using a new program throughout the system called Whole Health? It might be a good method to expand your work. Best wishes. This person is a survivor who's used yoga and acupuncture to be a more fulfilled person. All the best.
Well, thank you for sharing your experience. And we have worked with the VA. There's definitely more opportunity for us to do that. We are working on a grant that integrates neuromodulation with the Love Your Brain Yoga protocol. So there's opportunity there, but would also welcome people to reach out and talk through more VA collaborations with us.
Great. Another question, how do we find a Love Your Brain certified yoga studio in our state?
Our website shows state by state where we have our program and partnerships. We have canceled our all in-person programming through the rest of this year and shifted to this online program. If you don't see one in your state, since there are about 15 left that we have not found studio partners with, please still reach out to us and we can work with you to describe some of the criteria we use for partnership.
Great. Not a question, but just something to share. An individual who had a husband who sustained a traumatic brain injury a few years back. She says it's been a new challenge daily, but she's not considered yoga or meditation, but will definitely begin the process soon. So good to know.
Amazing. Let me know how it goes.
And then one last comment from Wendy, who's with the Rehabilitation Hospital in Indiana. She's a Love Your Brain yoga trained instructor there who has experience, and says that if anybody wants to chat about how wonderful the program is, please feel free to reach out to her. It's Wendy Waldman. So you guys can contact NASHIA and we can connect you with Wendy if you can't see that in your chat box. Kyla, thank you so much. It's been great. I know it's a very successful program in many states, and you know, the way we started off today was great. I love that. And you know, you guys please feel free to communicate with Love Your Brain or with us for any questions. Haley, if you'll just pop our slides back up at the end.
Thank you, Maria.
If you enjoyed today's event, stay tuned for announcements about webinars that we have upcoming in 2020 and then at the first of 2021. And of course, I'll put in a plug for our own State of the States conference, which will be in September. It's virtual, so we can ensure people's health and well-being as much as we can. Details and registration are on our website currently. And just, you know, finally, thank you so much for viewing our webinar. Please contact us to receive notice of future events and other resources. Everything that we do is archived online on our website. So we'd love to have you as a member or as an attendee for some of those webinars. Our web address is www.nashia.org. If you had challenges with any of the handouts and downloading those, just as a final reminder in the corner, you can contact us and we can get those out to you. Lastly, don't forget to complete your evaluations at the end of the webinar, and have a great day. Thank you.